It is an interesting disconnect, but I think you can kind of explain it by saying it's useful to the patient from the doctor's perspective, but maybe not from my clinical perspective. And I don't really want to add it to my workflow in addition to all of the other tools.
Hey gang, it's Tuesday, June 14th. Lisa, Rajiv, and listeners, welcome to the Behind the Numbers Daily and eMarketer podcast made possible by Marketing Architects. I'm Marcus. Today I'm joined by two folks on the digital health team. We have one of our analysts from that very team. It's Rajiv Leventhal.
Marcus, how are you? Happy to be here again.
Good, sir. Glad to have you. Thanks for being around. We're also joined by one of our principal analysts on that team. It's Lisa Phillips.
Hello, Marcus. Thanks for having us.
Hello there. Welcome to the show. Today's fact, health related. See what I've done? Contextual. Your blood makes up nearly 1/10 of your total body weight. Your blood makes up 8 to 10% of your total body weight. Hematologist and oncologist Daniel Lando, MD, explained to Live Science that the average adult has anywhere from 1.2 to 1.5 gallons of blood. It's pretty grim to think about blood in gallons. I don't know why I brought it up that way. Sorry. But it's interesting that, 10% of your body weight is blood. Speaking of blood, which is a weird sentence, but also which the heart needs very much, I also found out that science says owning a dog can lower your risk of heart disease. So dogs are quite literally the best, which we already knew. High levels of chronic stress are a leading cause of heart disease. According to the American Heart Association, dog owners typically have lower blood pressure and cholesterol levels, both of which decrease your risk of cardiovascular disease. Victoria's listening to this thinking to herself, my heart rate goes through the roof because of Chester.
I smell an upcoming report, Lisa, for us.
Oh, yeah, I want to know. Well,
the effects of dogs on
health. I'm sorry,
health.
Dogs stress me out. So.
No, Lisa. Oh, no. I need one. My parents have 4 dogs, so I think that means they're immortal. Anyway, today's real topic, digital doctors. So folks, today we're talking all about the digital doctor and how technology is swirling around their universes, more so now than ever, one could argue. Lisa, your report on this has digital doctor in the title. Why? Why digital doctor? What is that?
Well, the subtitle is How Technology Helps and Hinders Physicians. And that was the point, is that doctors are surrounded by digital technologies almost all the time, even in their personal lives. So I wanted to take a look at how it's affecting them and their workflow.
Yeah. So you talked about in their personal and professional lives. What digital tools do physicians use in both their personal and professional lives?
Well, doctors use smartphones, of course. And I had a nurse joke to me recently. Well, of course they use smartphones, right? When I said I found out what doctors use all the time. So smartphones, smartwatches, and sometimes they use remote patient monitoring devices. I guess it would be, in a way, if they had a condition, like a chronic disease condition like diabetes or something. But most often, those they just prescribe to their patients.
So that I found really interesting. So US physicians more likely to use a health-related app for personal versus professional use, slightly more likely to use an app for personal use, but they're more likely to use wearable devices in the professional setting. And by use, we mean recommend to their patients, right? Not walk around the hospital with a smartwatch on. That was according to Real Chemistry. So it got me thinking, why is this? And then you have this stat, so I'm wondering whether this is the right answer. There's a stat about the average age of doctors going up, the mean age of licensed US physicians growing in the last decade from 51 to 52 years, according to the Federation of State Medical Boards. Is that part of the reason? Is that, doctors, they're people, and older people typically don't adopt technology as much as easily as younger people. Is that why they're recommending smart devices, smartwatches to their patients more so than using them themselves?
It could be. I've had a doctor my age poo-poo my smartwatch and, Apple Health app and so on. So I do think age does have something to do with it, because as one doctor said to me, Younger doctors today can just go online and look things up. They didn't have to memorize like we used to have to. And they can sit there, he said, use so many inputs. And by that, I know him meant there's music going. They're looking at screens. They're talking to other people at the same time as they're doing things. So that's not something older people feel comfortable doing.
So I also thought it was interesting that when it comes to technology, right, US healthcare professionals are most likely to recommend patients use wearables, but they're least likely to store that data in their electronic health records. That was according to SSCG Map MD. There's a bit of a disconnect here, right? That the smart watches seem to be collecting all this data, and doctors are even recommending that patients use them, but the data just isn't being stored / used as effectively as it could be.
Well, I was going to say, I think the physicians see the value in them for patients just in terms of in between physician office visits to, track some rudimentary data and perhaps even a little bit more advanced than that. But then when it comes the time for the next doctor's a visit, they're not going to want to see the sheet that the Fitbit prints out based on what the data shows from the patient's usage. So it is an interesting disconnect, but I think you can kind of explain it by saying it's useful to the patient from the doctor's perspective, but maybe not from my clinical perspective, and I don't really want to add it to my workflow in addition to all of the other tools.
Right. A useful educational tool for patients.
Right. But its usefulness is sort of limited to that, at least from the doctor's perspective.
So, question, because we talked about doctors and digital doctors and how technology helps and hinders physicians, Lisa, which is the title of your report. So who's responsible for implementing all of this technology in hospitals? Is there a chief technology officer for the hospital, or doctors having to figure all this stuff out one by one?
No, it's just as you said, chief technology officers, sometimes, whole teams. It's very expensive, a lot of this equipment. We're talking millions of dollars. From MRI machine to an electronic health record system. So, they have very dedicated professionals there.
Okay. I was going to add, to get a little geeky, there's this actual title in most health systems called the CMIO, Chief Medical Information Officer. And they're a unique role because they have a clinical background. They're MDs in almost every case, but also an IT background. So usually they're, previously practicing physicians who wanted to get on the technology side and, learn that trade as well. So those are the people who have been hired in recent years to say, not only do you have to pick the technology from the vendor, but you have to train and educate the doctors on them. So it's quite a handful of a job.
Technology becoming more and more important. Today, some research from the report, today the most valuable capabilities to healthcare clinicians around the world are clinical knowledge, number 1, communications, number 2, and teamwork, number 3. In 10 years, physicians think technological literacy will be the most important thing, even more than clinical knowledge, according to Elsevier, an academic publishing company specializing in medicine. There's a part of the report, Lisa, that talks about how the pandemic changed physicians' workflows. How has it?
Well, first, one surprising thing for me was that hospitals and health systems practices had to scramble and get all kinds of new systems to support telehealth. And that added a lot to their workflows and billing and so on. And telehealth itself added a whole new wrinkle to their work days as they tried to figure out how to use these systems. And the patients were having trouble with the systems. They were having trouble with the systems sometimes. So that was a big impact. Was
the uptake of telehealth, how much was it being pushed before the pandemic? Because we obviously saw the surge during the pandemic, and we saw that, there was definitely some healthcare professionals that were offering telehealth beforehand. But I'm wondering how much it was being seen as the kind of part of the future of medicine, and how much telemedicine was hoping to help out with physician shortages, which is a big part of the report. You talk a lot about physician shortages and the impacts of those.
Not much telehealth was being done before the pandemic. And I think one of the big reasons why was there was just such a low awareness around it. And then the reason why it skyrocketed, of course, was just because it was forced on providers and patients. And now you're starting to see the numbers drop again. And if you think about how a lot of American patients think about COVID, and they are just sort of apathetic, don't really see it as a big emergency as much anymore. I'm okay with going into the physician's office, and that's why we're seeing telehealth use wane again. I'll
also add to that, though, that the CMS, the Center for Medicare and Medicaid Services, at the start of the pandemic, when the public health emergency was declared, they waived all kinds of rules around telehealth, where a doctor in one state was allowed to actually help somebody in another state. And now some of those rules in some states are rolling them back, or some insurance companies are saying maybe they don't want to pay for those visits, because then those visits were paid out, reimbursed, I'll say, at the same rate as an office visit had been. Mm-hmm. So it made it as lucrative, whereas before it was not paid out at the same, they were not reimbursed. Doctors were not reimbursed at the same rate.
Yeah. Let's zoom in on, double click on, whatever the hell you want to say, on this physician shortages piece, because reading that as a human being it's a bit worrying. What's going on here? How concerned should people be about this?
Well, physicians are getting older in a lot of cases, so they're closer to retirement. But, really the job, especially for primary care physicians, isn't quite as attractive and appealing as it once was, either from a compensation standpoint, or they just have to deal with a lot of bureaucratic and administrative crap that they don't want to. And, they're kind of getting into other professions. And I wanted to highlight the primary care specifically because, it's always felt like a underinvested and underappreciated part of the healthcare ecosystem. And, there's just not as many coming in as there are going out.
Mm-hmm. Yeah, you talked about bureaucracy being an issue. Cases of burnout for US physicians were some of the top reasons: chaotic work environment, too much time spent on bureaucratic tasks, lack of effective teamwork in the organization, as according to KLAS Arch Collaborative Report, Medscape saying bureaucracy, too many bureaucratic tasks, by far and away the leading reason.
And technology is a reason for burnout too. There's a really commonly referenced study that took place a few years ago that found that doctors spend on average twice as much time charting in their EHRs as they do seeing patients per day. So, these technology systems, going back to digital doctors, right? These technology systems are supposed to help physicians. Well, why are they spending so much more time in them? Really, it should ideally make things more seamless and quicker, but in many cases, that's not happening.
So those stats on paperwork, was that still related to inputting information into systems as opposed to like physically writing it down? Because there was two here. One, depending on the specialty, physicians may spend between 10 to 24 hours a week on paperwork alone, according to the Physicians in Thrive's Physician Compensation Report 2022. And then the second one, US physicians who use electronic health records still spend an average of close to 2 hours a day completing documentation outside of work hours. That was according to research from JAMA,
Yes.
Internal Medicine, published in March. So when we say paperwork, that can mean digital paperwork as well?
Yes.
Oh, definitely. Wow.
Yeah, I mean, most pretty much every single hospital has an electronic health record. There are some still small independent practices that are on paper, but it's probably talking about charting within the system, the EHR system.
Okay. I want to talk about EHR in 2 seconds, but the one stat on the physician shortages to kind of explain the gravity of the situation, the AAMC projecting a shortage of 18 to 48,000 primary care physicians in 12 years, according to a July report, an IHS Markit helped them with, and shortages of non-primary care specialists, surgeons, people like that, 21 to 77,000 physicians we could be in need of in 12 years' time. And huge real-life consequences besides burnout. A third of doctors in the US, UK, France, Germany, Italy, and Spain, Lisa, you wrote, said that they have seen an increase in medical errors made due to staffing shortages. That was from Survey Healthcare Global. Rajiv, you mentioned EHRs. What technologies could change the trajectory of physician shortages and burnout?
Well, artificial intelligence, I guess. Years ago, doctors kind of, one of the most buzzy things to talk about was, is AI going to replace doctors? Are doctors in fear of AI? But, that's not really the case. Lisa cites some data that doctors are really bullish about AI now and want to embrace it in their workflows. There are a lot of technologies that can be used in supplement with EHRs that can make these systems better. The problem with EHR is just going back to when they were, first implemented, stemming from the Affordable Care Act over a decade ago. They're kind of created as billing and charting systems, and they're not patient care systems. And I think we're seeing that bear out in reality today.
Interesting. Lisa, same for you?
Yes, EHRs, I would say, benefit from having, you don't know this, but they're just basically a dumping ground for data. The doctors can't find what they need right now. AI tools can go in and help them search. Google has one they're rolling out, they're working on. So, yeah, AI could help take away an awful lot of physicians' time on EHRs.
Okay. EHR is still by far and away the most important technologies for patient care. 78% of US physicians agreed versus 57% who said digital patient portals, 52% who said medical devices that integrate with EHRs, and 44% who said mobile apps, according to PwC Health Research Institute, also from Lisa's report. Well, finally, let's end with the most surprising or interesting finding from the report. Lisa, start with you.
Was the number of systems hospitals have. In one physician I interviewed said when he started there, he's the CMIO at this system, and he said there were 450 different systems.
I thought that was a misprint. No offense to our editing team, but I thought that they got that wrong.
And they've gotten it down to only 150 systems now. And if you imagine having to move data manually from one system to another just to send a bill or something, now you get some idea of the pain that doctors are going through.
Yeah. Rajiv, how about for you?
Well, it stole mine just because that quote was just so eye-opening in the number. But I'll go back to the AI. I am a little surprised how willing doctors are to embrace AI. It could be because they're getting used to the technology, or maybe it's younger physicians, or maybe they're just so tired of these old, outdated, clunky systems and the number of them that they use, and it's just so chaotic, and they believe AI can help. But I'm old enough to remember not too long ago where doctors didn't really like AI, and I am a little surprised to see that change.
Yeah. The one that jumped out to me, so some insider intelligence research from January found 20% of 18 to 40-year-olds, Gen Zers and millennials, have used interactive text or secure messaging to conduct scheduled medical visits. So I thought it was interesting because I started thinking that texting could become more common in terms of how people interact with their doctors. Maybe not going in as much, maybe not doing virtual chats as much, but just keeping in constant communication, whether that's appointment reminders or getting prescription drugs or confirming things, asking questions just from texting. I'm surprised, folks, though, that neither of you said this as the most surprising or interesting finding, because there's a section in the report titled, "I saw my doctor on TikTok." Mm-hmm. What the hell is going on? Lisa, explain this, please.
There's so much misinformation that was spreading on the internet. Remember hydrochloroquine or whatever it was?
Hydrochloroquine, yeah.
Yeah, I mean, things like people, and people are still trying to get that horseworming medicine. Doctors are having to, a lot of doctors felt that they had to go on TikTok, social media, and present, or actually start podcasts themselves and present real data. And really, to try to refute all this. Some, of course, are marketing themselves under the guise, but for that, it's not every doctor. And believe me, they're not getting reimbursed for it, but they have had a lot of patients. They're sick of dealing with patients coming in and asking for these COVID, supposedly, cures. Mm-hmm.
Yeah, you point out that the internet is a very convenient source of health information, and also you write misinformation. And the stats here, US adults 50% more likely to go online for medical advice than they were to contact a medical professional. 50%. Now, living in the States and realizing that anytime you want to speak to a medical professional, you have to pay some money. So they sit behind a paywall. That actually makes more sense to me, having lived here. But 92% of Gen Z people look to social media for the same thing. There's a survey from clinical trial platform Power. You said YouTube was the most cited platform for health advice.
Well, I'm writing a report on consumer health in Google, and over 8 in 10, I think, just healthcare searches in general start online, which isn't too surprising. You're going to have a problem or a question. You Google something, but it's interesting to think about how many trust the internet versus a physician. And why that is.
Well, let's also say Gen Z, the top age is 24.
Right, they don't know what the hell they're doing.
Thank you.
No offense, Gen Z people.
Dr. Google.
That's our Dr. TikTok. That's where they go.
Yeah. Bloody Gen Z people. They're responsible for all the bad stuff. I feel like that's what we always conclude with. It's Gen Z's fault. That's what we got time for the lead. It's time now for the halftime report. Couple of takeaways. Lisa, what's yours?
The doctors really see technology as helping them and their patients, but right now it's just a big time suck the way technology has been built.
Rajiv?
Well, we're talking about technology and for good reason, of course, but, the soft skills and the competency around training and education is just as important. When you think about what it takes to not only train doctors on a specific technology system, but educate them on the complexities of them while at the same time simplifying, it's not really easy. You kind of have to not speak in engineering or technical jargon and talk about relational databases. You have to speak in their language, and otherwise you're not going to get the outcome that you want.
Excellent. Well, Digital Doctors 2022, How Technology Helps and Hinders Physicians is the name of the report by Lisa. So check that out, hot off the press. You can go to insiderintelligence.com if you're a pro subscriber and get access to that. All right, it's time now for In Other News, but first a quick word from our sponsor, Marketing Architects. TV advertising is a powerful channel for growth, but the traditional process for launching TV campaigns is expensive and complex. That's why Marketing Architects changed it. With all-inclusive TV advertising, they invest their own money to produce, analyze, and optimize your campaign. All you pay for is media, setting you up for rapid growth at an extreme cost advantage. And they wrote a book about it. Go to marketingarchitects.com/book to get your free copy today. Folks, we are back today in other news. Pharmacy benefit managers face growing scrutiny about their role in rising prescription drug costs, and CVS Health rolls out a virtual care solution. Story 1. The Commonwealth Fund explains that pharmacy benefit managers, or PBMs, are companies that manage prescription drug benefits on behalf of health insurers, Medicare Part D drug plans, large employers, other payers. By negotiating with drug makers and pharmacies to control drug spending, PBMs have a significant behind-the-scenes impact in determining total drug costs for insurers, shaping patients' access to medication, and determining how much pharmacies are paid. PBMs have faced growing scrutiny about their role in rising prescription drug costs and spending. So that's to set the scene of this story. And so in a recent example, the Federal Trade Commission is probing CVS Caremark, Express Scripts Inc., and other large pharmacy benefit managers, PBMs, over the impact their business models have on the accessibility and affordability of prescription drugs. The inquiry will examine what impact their businesses have on cost and access to prescription drugs, writes Catherine Hardison and Joseph Walker of the Wall Street Journal. The FTC will require the 6 largest PBMs to provide records and other information about their business practices so the FTC can conduct a study of the PBM industry. But Lisa, your big takeaway from this FTC inquiry into PBMs is blank.
It's about damn time.
Oh yeah? Tell me why.
Because PBMs do set the price for drugs. I have literally been at a CVS counter and been told this drug that you need for your child is, because your insurance changed, you're in a gap, it's going to be $900 for a month. And someone said, go to Costco. I went to Costco. The pharmacist behind the counter said, don't give me your insurance card. It's only $33.49. But if you give me your insurance card, I have to charge you $900. So
makes sense.
And that's a PBM.
It's a labyrinth. Yeah. We'll see what happens with the inquiry. The 3 largest PBMs manage roughly 80% of US prescriptions. So by conducting this investigation on the 6 largest, you're getting pretty much the whole industry. So we'll see what happens with that. Story 2. Rajiv, you recently wrote about CVS Health rolling out a virtual care solution next year to eligible Aetna and Caremark members, of which you point out there are 110 million odd. The service lets folks get care at a retail clinic, virtually or in their home. Eligible members can start using the service next year, you note. But Rajiv, your initial reaction to the news of CVS Health rolling out a virtual care solution was blank.
Well, we're going to have to stop calling CVS a retailer soon. They're a healthcare company. This virtual primary care offering really kind of poses a competitive threat to health systems, to primary care incumbents, many of whom are really behind on launching this type of consumer-friendly offering. And they're just looking for ways, CVS, to integrate their care delivery business, their retail clinics, and of course their insurance arm, Aetna. And this is just another move in that context. And they're really enhancing that virtual care presence to keep patients and attract new ones. They're becoming an ultimate primary care disruptor.
Yeah, you had two fascinating points in the article. You just mentioned we have to stop calling them a pharmacy, and people might be thinking, why? Well, I don't really see them as a healthcare provider still. 2 points here. One, people growing more comfortable, you point out, with using CVS for healthcare due to the pandemic. CVS administered over 32 million COVID-19 tests and nearly 60 million COVID-19 vaccines last year. And also, point number 2, CVS went from supporting 10,000 virtual mental health visits in 2019 to 10 million 2 years later.
Pandemic is a big reason why, and that's not unique to them. It's all the people that got their shots and their tests at retailers. But the one thing that does make CVS different is that they have an insurance arm. That's a huge part of the healthcare business, right? They acquired Aetna years ago, and that's springboarding a lot of this.
Yeah, a staggeringly quick transformation in how people see them in the last couple of years. That's all we've got time for. Thank you to Lisa.
Thank you, Marcus.
Of course, thank you to Rajiv.
Thank you, Marcus.
Yes. Thanks to Victoria, who edits this show, and thanks to everyone listening in. Get at me on Twitter at @justmarcus_behind-the-numbers to say hi, and I'll say hi back. Tune in tomorrow for the Behind the Numbers Reimagining Retail and eMarketer podcast, made possible by Marketing Architects, where our very own Sarah Lebo will be hosting analysts Blake Drosch and Zach Stambor to discuss subscription e-commerce.